Hi, I'm Dr. Kim Carlucci from Montclair, New Jersey. Well, how long does it take to create irreversible damage even after a small injury in your spine? Well, today we are going to be talking about self-care. After an injury, you don't want to wait things out. When you have any kind of pain or any kind of discomfort, it's an indication that something is not right. The medical doctor usually will prescribe a mild anti-inflammatory and tell you to return in 2 weeks if it's not better. Well, I'm here to tell you that that really is not a good idea. The nervous system remodels after the peripheral nervous system, which is the area that's shouting that you have pain, says long enough, I'm in pain, I'm in pain, I'm in pain. So the peripheral nervous system sends that to the central nervous system. And at this point, the central nervous system will cause a change in reflex patterns that will be permanent. You must be fairly aggressive in the first 2 weeks of an injury to restore function and motion to the area of discomfort. Of course, this is not including things like bone fractures or surgical procedures. You don't want anything to become chronic, and you don't want your body to adapt. When you have a sprain or strain injury, a sprain being the tearing of the tissue and the ligament, and a strain being a tearing or the breakdown of the tissue and the muscle, most people wait to treat. In the journal Life Sciences, volume 137, September 15, 2015, in a study called Sensorial, Structural, and Functional Response of Rats Subjected to Hind Limb Immobilization, researchers found immobilization in rats for 2 weeks leads to sensory dysfunction, accompanied by systemic reduction in protein strength. That means reduction in changes in bone density and thickness, reduction in the muscle strength and the size of the muscle mass, and diminished function. Studies have shown that immobilization of an area of a vertebrae due to any kind of trauma or immobilization of any sort for a time period of 6 to 8 weeks will cause irreversible growth of spurs and cartilage breakdown, which equates to the start of arthritis. This was revealed in the journal May 2019, volume 19, issue 5, in a study called Controlled Immobilization Traction based on intervertebral stability is conducive to regeneration or repair of the degenerative disc. The authors demonstrated that the disc degeneration is a cascade biomechanical and structural changes mediated by cells in an abnormal mechanical environment. What does this mean? It means that treatment 2 to 6 weeks is a sensitive time period for regeneration of a degenerated disc. The first 2 weeks are the most effective in treating an injury. If you have had an injury longer than 8 weeks, and we're talking about months or years, you're not without hope. The treatments typically for those type of conditions, which are chronic, have to be more repeated and for a much longer period of time. And it helps to stop or hopefully to stop the degeneration. Sometimes it can reverse some. My point is not to scare you, but to talk to you about time management. Most people don't get help until they're in a pain or in a crisis situation. You spend far less time at the chiropractor if you nip it in the bud within the first couple weeks of an injury rather than waiting until you're in that crisis phase. Then you have to spend 2 to 3 times a week for a couple of months in treatment. Please don't neglect your health. I hope, once again, that this information motivates you and it's useful. I'm Dr. Kim Carlucci, and as always, chiropractic brings out the best in me. Let it bring out the best in you.